Hi there, welcome to my poster presentation called Application of Genetically Engineered Microbial Bacteria Species as a Mediator for Radiation Therapy-Induced Bowel Injury. My name is Jameus, and before beginning, I would just like to say that I have nothing to disclose, no affiliations with any organizations, and the financial support for this research project was received by NSERC, CIHR, and NHRC funding agencies. The goal of this research project is to observe how radiation affects the gut microbiome as well as the gastrointestinal tract itself. Over half of all patients will undergo radiation therapy, which is associated with a lengthy list of side effects that greatly affect patient quality of life. The low tolerance of abdominal and pelvic organs, coupled with the high doses of radiation needed to abolish a tumor in this area, poses problems when planning treatments and attempting to minimize side effects. We think that the bacteria in the gut might play a key role in cancer therapy-induced microbial dysbiosis, and we hope to genetically engineer bacterial species in order to fight the gastrointestinal side effects of radiation therapy treatments. Experiments were conducted on Lactobacillus reuteri and Bifidobacterium bifidum in an anaerobic glove box. Growth was characterized, and then irradiations at 50 gray were performed to examine the effects at a common human pelvic dose. Additionally, C57 mice were irradiated at various doses, and their gastrointestinal tract was harvested 2 days following irradiation in order to characterize the effects of radiation on the gut microbiome through 16S metagenomics, as well as the gastrointestinal tract through histological analysis. Results of the 50 gray bacterial irradiations show no change in growth rate or survival in either species. Figure 9 shows the average GI length in the mice we irradiated, which seems unaffected. Figure 10 shows 16S metagenomic results, allowing us to see what species of bacteria were present in the mice gut microbiome. And Figure 11 shows an example of the histology slides we will use to score the villi and crypts of the mice. Future goals for this project are to produce strains of bacteria capable of increased short-chain fatty acid production through CRISPR technology, inoculate these engineered strains into the gastrointestinal tract of mice, and then monitor the gastrointestinal tract of these mice to see if our bacteria will help to alleviate any of the damage induced by radiation therapy treatments.